Robert MacArthur, MD, breaks down 3D printing and orthopedics and custom solutions for complex cases. The integration of 3D printing technology into orthopedic surgery has marked a shift in how complex cases are approached and managed. Surgeons like Robert MacArthur, MD, a respected orthopedic surgeon from Albany, New York, recognize the immense potential of 3D printing in providing patient-specific treatments. One of the most significant applications of 3D printing in orthopedics is the creation of customized implants and prosthetics. 3D printing technology addresses this issue by using patient-specific anatomical data to create implants that match the exact dimensions and contours of the patient's body. These models give surgeons like Dr. MacArthur a tangible representation of the patient's anatomy, allowing them to plan and practice the surgery beforehand. In complex orthopedic cases where standard solutions may not be viable, 3D printing offers innovative options. For example, in cases involving bone tumors or severe trauma, customized 3D printed bone replacements or scaffolds can be created. These are designed to perfectly fit the defect in the patient's bone, providing a framework for new bone growth and facilitating more effective reconstruction. Numerous case studies demonstrate the success of 3D printing in orthopedic surgery. These success stories not only highlight the potential of 3D printing in complex cases, but also its role in enhancing overall patient care. This hands-on experience is invaluable in preparing surgeons for real-life scenarios. Looking ahead, the future of 3D printing in orthopedics holds tremendous promise. Its ability to provide customized, patient-specific solutions is enhancing the precision and effectiveness of treatments. Surgeons like Robert MacArthur, MD, are at the forefront of integrating this technology into their practice, leading to improved outcomes for patients with complex orthopedic needs.